Hello folks, welcome back. If you're new around here, my name is Kweku and I am a pharmacist. Today I'm briefly going to be reviewing the medication Eliquis or Apixaban. We're going to take a look at the description, we'll take a look at some side effects, some potential drug interactions, as well as I'll give you some tips as to how to save on your Eliquis prescription if you are watching this video from the US. Little disclaimer though, this review is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is Eliquis? Well, Eliquis or Apixaban is an anticoagulant or a blood thinner. It is used to lower the chance of stroke in people with a medical condition called atrial fibrillation, which in very simple terms is a fast and irregular heart rhythm. Now, one of the biggest concerns in atrial fibrillation is the potential to develop blood clots within the upper chambers of the heart. These clots may circulate to other organs, including the brain, and in which case it may cause a variety of problems, including a stroke. So Eliquis is thus prescribed to people with atrial fibrillation to prevent just that. Eliquis is also used to treat or prevent blood clots in the veins, usually after a procedure like maybe a hip replacement or a knee replacement. It is also used to treat or prevent blood clots in the lungs in a condition known as pulmonary embolism. The dosage varies based on the exact condition that is being treated, but for atrial fibrillation, which arguably is the most common use, the dose is typically 5 milligrams given twice a day. With respect to side effects, Eliquis is generally well tolerated, with the most commonly reported side effect being bleeding. Of course, this makes sense since it is an anticoagulant after all. So it's definitely a good idea to know what the signs of bleeding are so that you can report to your doctor if any of them is observed. Now, some of the signs that you can look out for include a red, pink, or brown urine, red or black stools, looks like tar, coughing up or vomiting blood. Sometimes the blood may look like coffee grounds, headaches, feeling dizzy or weak, nosebleeds that happen often, and menstrual or vaginal bleeding that is heavier than normal. Some other minor side effects like skin rashes, allergic reactions, and sometimes nausea have been reported, but in the grand scheme of things, those are very minor relative to the benefits that Eliquis provides. When it comes to drug interactions, the first one on the list is NSAIDs. NSAIDs are medicines for pain and inflammation like ibuprofen and naproxen. Now, these increase the risk of bleeding, hence only take such medications with the knowledge of your doctor. Usually, your doctor will monitor your response and determine if even it will be appropriate for you to take both of them concurrently at all. So the general rule of thumb is that if possible, avoid the concurrent use of NSAIDs and Eliquis until you are given specific go-ahead by your medical providers. Another potential class of medications that may interact with Eliquis, of course, are other anticoagulants and blood thinners like warfarin and Lovenox. Now, these also increase your risk for bleeding as well. So usually there will be a protocol if, for example, you have to switch between these medications. So it's very important that you understand your doctor's instructions and follow them carefully, because any errors may significantly increase your risks for bleeding. Now, another medication that I wanted to mention is St. John's wort. And I particularly brought that one up because it is over the counter, so there is a possibility that your doctor will not know that you're taking it. So St. John's wort tends to cause an increase in the enzyme that breaks down Eliquis, hence rendering it not as effective as it should be, thus increasing your risk for developing blood clots and subsequently strokes. So in very simple terms, medications like St. John's wort can actually increase or expedite the breakdown of Eliquis faster than it would have gotten a chance to prevent blood clots. Now, some general best practices whilst taking Eliquis include letting your doctor know if you're going to have any procedure done, or any surgery done, anything that may increase your risk of bleeding, even sometimes dental procedures, because mostly they would discontinue Eliquis for about 24 hours or so to minimize your risk of bleeding. Also, it'll be a good idea to take extra precautions and, if possible, avoid activities that may increase your risk of bleeding, like certain sports which may make you prone to injuries. Extra care obviously should be taken when you use knives and sharp tools, and it's also probably a good idea to consider using an electric razor instead of a blade, just to minimize the risk of cutting yourself and the bleeding associated with that. Now onto some savings info. If you're watching this video in the US and you have commercial insurance and you satisfy some eligibility requirements, the manufacturer has some support, some copay assistance that I'm going to put a link in the description that you can access As of the time of doing this video, they have 2 promos going. There's one where you get your first 30 days of Eliquis for free, and then subsequently you can get it for $10 per month for up to 24 months. So I'll put the links in the description. Just make sure you qualify, you meet all the eligibility requirements, and you will be on your way to saving some money. I hope you found this video useful. If you did, consider subscribing if you have not already done so, and share with anybody else who you think may find it useful as well. Thank you so much, and I'll catch you on the next video.